Good morning. I think it's still morning-ish. It's almost noon. Well, it is that strange time. Although our friend online, she is in California, so it's definitely morning for her. Um, so thank you, Danny. Can you hear us all right out there? She can.
Yes, I can.
Good. Yay. Okay. Good morning, everybody. Glad to have you. My name is Christy Brooks. I will sit down too. I don't usually like to sit. I like to walk around. I am the regional director for SAMHSA. We've heard SAMHSA talked a lot over the past 2 days about different types of funding and programs that SAMHSA has. So SAMHSA is the Substance Abuse Mental Health Services Administration. We are a operational division of HHS. We've heard about HHS yesterday as well, the Health and Human Services. Talked a lot about President Biden's agenda and things that he and his administration have done over the past term, specifically for substance abuse, mental health, and specifically for this health summit for Asian Americans and Pacific Islanders. So just what we're going to do, we're going to make this really conversational because I think the three of us like to talk. So, and Danny, we're assuming you like to talk too, since you got up super early to come on this session. We actually had Danny's subbing in. She's in Zoom land out there, but she's subbing in for Jerry, who was under the weather yesterday. So we're thankful for Danny for coming in too. But again, I've only been with SAMHSA for about 2 years. Prior to coming to SAMHSA, I live in Oklahoma. I've lived in Oklahoma for about 24 years. I'm a member of the Choctaw Nation of Oklahoma, so I'm a tribal member, and I worked for my tribe and on my reservation for the last 15 years, running the behavioral health department there. So it's very interesting listening to everything we've heard over the past day and a half about culture and about race and ethnicity. And I could have closed my eyes and thought that I was in a tribal session of Native Americans and the Indian health that we work on. So a lot of the same issues. So although I am not Asian American, I am American Indian, and really kind of same thing. Yep, that's what my Pacific Islander friends say. They're like, "Well, you're basically one of us." I was like, "Okay, thank you." So anyway, so we're just going to talk a little bit today, kind of about some services and programs that we have. But I'm going to introduce let my colleagues introduce themselves. Paula, you want to go ahead and start? Tell us a little bit about you.
Sure. Good morning. My name is Paula Johnson, and I'm the Bureau Chief for the Harris County Area Agency on Aging. We are actually located within the Houston Health Department. I am originally from Georgia, served in the Army for 27 years, actually retired from the Army for 27 years. And background actually is in public health, is how I actually came to the health department. And then my interest was drawn to the Harris County Area Agency on Aging, where I've been almost for about 10 years. Worked at CDC during the Ebola and Zika syndrome or pandemic, whichever you want to call it, actually, that was going on at the time. But our services are for older adults and that live in in Harris County, 60 years and older. And so I'll turn it over.
Good morning, ladies and gentlemen. My name is Stephen Lee. I am the program director at Lac Hong Adult Daycare here within the International District, where my colleagues here are the beginning of the resource. I am the end of the day resource, being that we have an adult day program over there. We have approximately 80 elderly and disabled adults that come there Monday through Friday. The purpose of our program is to give them a structured environment where they're able to focus on their nutritional health, mental health, and physical health, while also staying within their communities. So we have a culturally based program. Some things have worked, some things haven't worked out so well, but you know what? We're all kind of jiving through it together. We're working through a lot of things post-COVID. Love to talk to you guys a little bit about it and see what you guys have been doing, what works with you guys, what doesn't work with you guys. And I'll share with you what has kind of worked with us. So yeah, we've been there since 2005. We were blessed to be hitting 19 years this year, actually. So that's about what we do.
Danny, up there in Zoom land, can you introduce yourself?
Sure. I don't think you can see me, but you can hear me, right?
I hear you. Yes, ma'am.
Okay, great. Well, hi, everyone. good afternoon, maybe. My name is Danny Lee, and I am ACC Senior Services Lifelong Learning and Wellness Program Manager in Sacramento, California. ACC was originally created as the Asian Community Center about 50 years ago, and now we call ourselves a community of caring, and it was created backed by Chinese and Japanese community activists who wanted to make culturally sensitive health and social services accessible to our community. For example, there was no rice at any of the local nursing homes. So that's just one example, but so really excited to be here and chat with you guys. Thank you.
Thank you, Danny. And again, thank you for subbing in. I know that was pretty last minute last night, so we appreciate you. I'm just going to start a little bit with SAMHSA. I think most of everybody probably knows what SAMHSA is or what we do, but I'm going to give you the Cliff Notes version. Really, SAMHSA is the lead federal agency for all things substance abuse, substance use, and mental health. So we act as the subject matter experts in, with funding, with research, treatment. We fund states, we fund territories, we fund tribal nations for really a vast amount of things. If you look on the SAMHSA website, which is my favorite website of all times, because there's so much information in there, free information, free resources as well. So definitely would encourage you to go there. But really looking at funding states and territories and tribes for like your state block grants, thinking about state hospitals that are run here in Texas, thinking about CCBHCs. I think we've heard a little bit about that yesterday, which are certified community behavioral health centers. We've talked about FQHCs, the federally qualified health centers, which are done through HRSA. That's our sister agency. But the CCBHCs are really meant to be community-based, certified community-based health centers in areas of need. So SAMHSA really works at funding those. We fund universities for different research. A lot of money goes to even here in Texas, UT Austin, UT San Antonio. A lot of different centers that come out of SAMHSA. So this is our Assistant Secretary for Mental Health, Dr. Miriam Delphin-Rittman. And really what SAMHSA looks like, that we actually just redid these priorities. So these are priorities for 2023 to 2026, all going through the lens of equity, trauma-informed approaches, recovery, and commitment to data and evidence. We all know that if there's no data to support what we're doing, it's often hard to get funding for those things. Data is my worst enemy. It's not my favorite. I think, well, duh, there's a need. Let's go do it. Why do I have to show you the data? Just come look, come to our community and I'll show you. But the federal government doesn't really like that. They want to see numbers and data. So really what we're looking at doing is preventing substance use and overdose, enhancing access to suicide prevention, promoting resilience, integrating behavioral health. And of course, we've talked a lot over the past couple of days about strengthening our workforce. What does that look like? In the session, I think before this, we were talking about, receiving mental health services by somebody that looks like you, that comes from your area, that speaks your language. On the tribal side, we had the same thing in Choctaw Nation. If you do not understand what it means to live on a reservation or live in a tribe, it's very different. And so we heard a lot about that with language, with culture, and how we can ensure that we're bringing folks up in our culture to continue the work that we're doing. And I loved one of the sessions yesterday. I think it was Cougar Chain or Cougar Train yesterday. She was talking about the work that she's doing at the university, and then bringing those pre-med students up into the community. It was really, really cool. So anyway, this is really kind of what SAMHSA does. I'm happy to answer any questions later if you guys have specific questions about it, because I know that there's a lot of questions with funding and with grants. But basically, we are a grant funding agency. So we are, really looking at funding. We can fund small areas, we can fund large areas, et cetera. But for all purposes of mental health and substance use. This is just a slide that we show as regional directors in every presentation we give. these are the national numbers. These are the national numbers we know about. We know about suicide. We know that suicide is a major issue in America. We know that substance use is a major issue. We know that the opioid epidemic. We know that we've lost over 107,000 people in 2022 to opioid abuse and fentanyl overdose. We know that we've talked a lot about over the past day and a half about youth. We know that a lot of our issues start with our young kids. And I know we're here to talk about older Americans, but there's the youth aspect of that and what that looks like. And then these are just a couple slides from our recent survey of a recent national survey looking at Asian adults ages 18 or older with past year mental illness. So one of the things I know yesterday, if you were here in the morning, there was a little bit of differing data with as far as some of the presentations and one as far as how much mental illness or how much suicidal ideation or suicide completion within the Asian American community. And so I went back and looked, and I think both of the data sets yesterday were correct. They were just kind of articulated a little bit differently. So I wanted to kind of just to check in on this. This is not about suicide necessarily. This is about mental illness. But really the idea of this slide is really looking at everything that was said yesterday is true. The higher the number, the youth is always going to be that issue, that area of age that they struggles the most. So we know that 18 to 25-year-olds have a higher prevalence than others in as far as severe mental illness. That is definitely a fact. That's a fact in Asian Americans. That's a fact in almost all of the population, all of our populations. And so I want to just kind of make sure that you guys saw this, and I can also give you a link to the actual NSDA data that supports that if that is something that you would like to see. And then this is on our past thoughts of suicide plans, suicide attempts among Asian adults age 18 or over. That was one of the things that was said yesterday, but the thoughts. I think that was Dr. Shaw? I can't remember, but the thoughts were pretty large. So you can look at this number and you can look at the 18 to 25. That's a huge number of thoughts of suicide, made a plan, attempted suicide. The suicide rates for aged 18 or older Asian Americans is still relatively low in conjunction to other races and other populations. So I just wanted to kind of throw this up there. Happy to talk more. If you guys need any more information about that data, happy to show that. Okay, so I'm going to be quiet and I'm going to send it over to Paula because that's where the real work is done here in Harris County. So Paula, take it away.
All right, thank you. And if it's okay, I'm going to stand up as well. It's just a little bit easier. So as I said thank you so much, Harris County Area Agency on Aging, next slide. And so I'm just going to run through quickly some of our services because we have quite a lot. And so I'll start with the access and assistance services. So we do have a call center. And I'll give that number. There are actually some brochures out on the table in multiple languages, but to reach us our number is 832-393-4301. And that's the number to reach us for everything. So under our access and assistance services, it's like our call center, it's our benefits counselors. As you may know, we just went through Medicare open enrollment, as well as our outreach. So that falls within that. We also provide evidence-based classes. So these are classes that have to be approved through the National Council on Aging, and then those are classes that we can do. And so one class that I'll just sort of highlight is PEARLS, and it's an acronym, so I can't tell you exactly what it stands for, but it is a depression screening class. And so we have classes like Matter of Balance, diabetes self-management, chronic disease self-management, arthritis management, bingo size, all type of exercise classes that are beneficial for older adults. We also provide caregiver support. So caregiver information services that are available to help older adults, help actually family members or any other loved ones or friends that are in the caregiver space to help them learn how to adjust to being a caregiver. And within that also comes caregiver counseling, because it is a hard role to find yourself in. And so this is one service that is not, you do not have to be 60 years of age or older. The caregiver can be anyone 18 years or older that is doing caregiving, providing support. Our supportive services, because we know that Medicare and Medicare Advantage plans do not provide everything that you need. So we provide dental, vision, hearing, incontinence supplies, nutritional supplements. I think that's pretty much it for those services. Under care coordination, this is where if someone needs help identifying services such as in-home services, that's where someone comes into the home and will provide things such as helping someone get bathed, helping them get dressed, helping them take their medication. And that falls over into our in-home services. But the care coordination is our group of social workers that will help you identify and put plans together in place. Our biggest program is our nutrition programs. And so nutrition programs are two. We have home delivered programs, and those are for those who are either bed bound or homebound. They must meet a certain score to be eligible for that service. But if not, we have our congregate programs. We do about 1.5 million meals a year. And I was going to mention the A-Leaf Community Center, which is maybe about a mile down the road. It just opened last February. We thought that would be a smaller, most of our sites have about 45 to 60 participants a year. There's a primarily Asian population, but we have enrolled well over 1,300 individuals. They run about 200, the space only holds like 250, and there are about 200 seniors there every day. It is an awesome site, and it's a beautiful building. If you ever get an opportunity, please go down and visit. Care Connection is our Aging Disability Resource Center. The difference between the ADRC and then AAA, or Agency on Aging, is that they see anyone of any age with any disability. They also help older adults who are in nursing homes who want, if the resources are there, come out of the nursing home back into the community. That's one of their programs, and so they also are there for professionals with education. Hope I'm doing it. Yes. We also provide transportation services. We have services to help older adults get to our congregate programs, but we also just started sort of a pilot program right now where we have a contract with a entity who they have a contract with Uber and Lyft. And so we're able to allow older adults not only just to be able to, go to their meal site, but this pilot is allowing them to go out and do things because we realized during COVID with social isolation, is that seniors need to be able to travel. Houston is a large place. Harris County is a large county. And to go from, let's say, from Humboldt, and they want to come up and visit their children who maybe, I don't know, maybe live in 3rd Ward, 5th Ward, live in Katy. It gives them an opportunity to travel. It's a limited program, but it's moving very well. Residential repair. The goal of AAA services is to allow older adults to remain in their home as long as possible. And through residential repair, it's minor repair. It's just meant for health and safety, not beautification. Ramps, raised toilet seats, grab bars, if they have something that could cause them to fall. And this our big one, mental health counseling and caregiver counseling. We started this pre-COVID, and what we've seen is an uptick. And once we went into COVID and we actually went to where all of our seniors were getting their meals delivered at home, we started having things such as suicide. And unfortunately, we lost some seniors who just could not deal with the isolation, and they didn't know what COVID was going to look like. It was at the very beginning. And so what we've seen over the last couple of years, and we have a contract with a partner who has a very diversified staff. And so we've seen an uptick in our mental health counseling, and caregiver counseling was just added about a year ago. And so we've seen an uptick in that as well. We have now started social reassurance. We used to have pre-COVID where we had seniors that could have someone come in their home, just sit with them, talk with them, and just sort of visit with them. With COVID, people don't like a lot of people coming into their homes. And so now we are going to move to social reassurance, which is where you can have a conversation with an older adult through Zoom, through Teams, through just a telephone chat, just to see how someone is doing, because we have realized that loneliness is very impactful. And so we're hoping to help alleviate that. I spoke about benefits counseling and call center. And so please feel free if you have any questions about any of our services. And I may have missed a couple because we have a lot. Just let me know. Thank you.
Thank you. Okay, we're going to go on to Danny, and then Danny's going to talk a little bit about her program, and then I already have so many questions that I've come up with in my head. But we're going to go forward to Danny. Are you ready?
I am ready. Thank you so much. Okay, so like I introduced our center before, we are ACC Senior Services, a community of caring. And so these are some pictures here of our senior living facilities. But so we have 3 of them along with a community center. And so we like to talk about ACC as a whole as a continuum of care. So we start from the very beginning when they're younger seniors, active, coming to our classes. Maybe they are caregivers themselves at the time. Then they may move into a point of their lives where they might need some other living services where they need help with their meals, or then eventually moving into one of our living facilities. And so we have a variety of multilingual and multicultural senior living communities, including short stay rehabilitation, skilled nursing, assisted living, memory care, and independent senior apartments. And you can go to the next slide, please. And so this also includes our home and community-based programs at our community center. And so this has a variety of health and social service programs, many of which our colleague before had also mentioned. It's interesting to see how similar we are in different states, but it's wonderful. And so the point of our programs is really to make sure that we help seniors and their families and caregivers be healthy and active and socially engaged. And I don't know how small it is on your screen, but that top picture is a few pairs of mothers and daughters from our Mahjong club. 2 of them are 100 years old. I think one is turning 101 this year. Teruko on the far right, she just earned the key to our city a couple weeks ago. And so we had a whole little ceremony, which was wonderful. And they actually, several of them speak Chinese and one other speaks Japanese, but they all play together, and it's just really beautiful to see that they can connect with others even with different languages. And so their daughters are also seniors themselves. So they are, it's really wonderful to see different generations of seniors come and be a part of our programs. But quickly through the things that we offer, we have transportation, caregiver support, care coordination. We are also a member of our Aging and Disability Resource Connection, which is along with our area agency on aging and resources for independent living. Our lifelong learning and wellness programs include in-person and online classes and clubs. Our senior escort program is a program where volunteers can meet seniors who feel uncomfortable or unsafe in public spaces. Our utility assistance program, which helps people in language with their utility bills and phone bills. Our senior employment program. We do also have the PEARLS program, which stands for a program to encouraging active and rewarding lives with seniors. So that's the mental health coaching. And Meals on Wheels, which is home delivered meals. And last year we served over 2,900 participants and clients within our community center, online, special events, and our Meals on Wheels program. And and many of our participants are also living with at least one physical or cognitive disability. Next slide, please. And this is just a picture, several pictures of some of the things that we've done. On our left-hand side, we have Beverly and Stephen heading to pear picking on a field trip. In the middle is Jessie, who went on a walk here with Anna, and they went to walk to a Tai Chi class around the corner from her house and back. She doesn't feel comfortable going on her own in case she falls. Of course, there's bingo. We have transportation, and then we also in the middle bottom corner, in the middle bottom picture, we have Connie, who is also blind. And so it's really wonderful for her. She told us that she likes to be visible in her community, let them know that someone blind is in their neighborhood. And she's with Virginia, who is going for a trip to the grocery store so she can help read the labels for her. And in poker, we are not gambling, I swear. We're just doing it for fun. But we do have poker and bridge on Tuesdays. But really since the pandemic, we've been really working to develop what we're calling the no wrong door system. So basically, at any point you enter ACC for whatever reason, even as a volunteer, as a participant, as a caregiver, at some point, all of our programs are integrated and they are followed up with. So then that way we can all make sure that they have easy access to whatever they need to be healthy and living independently. And next slide, please. And so really our biggest focus is social connectedness. We're really going to be working on focusing on social health this year. It comes to no surprise to you all, and you all have heard this, but social isolation and loneliness in seniors was an issue even before the pandemic, of course. And so 43%, a lot of studies show that that many older adults are feeling lonely on a regular basis, and that 1 in 4 older adults are also socially isolated. And poor social relationships are associated with risk of heart disease, increased risk of stroke, and a weakened immune system, increased risk of dementia, you name it. So it's becoming really apparent to us that that's going to be our focus, that we feel like we can play a part in with these seniors' lives. And so especially at the community center, we're realizing that we are basically a second family member to a lot of people, and you do end up feeling like their family after a while. In the top right hand corner, we have Millie and Ruby. They are in our social hour learning how to make little scrubbers. One of our 92-year-old participants was teaching them how. They are both Japanese, and actually there were 3 people in social hour last week that realized that they were in the same internment camps when they were 5-6 years old, and they remember each other's families, and they were in other states too. So it's just really incredible the kind of connections that people make. And so it's really important for us to focus on some of these things here, like outreach and collaboration. And you guys were talking about before how important it is for people to know about our services, because if you don't know, then how can you get connected? But building trust relationships and hospitality has been so important to us, because we hear people saying that they don't want to complain to their family members for help. A lot of times they live with their children and they're just grateful that they get groceries delivered to them. They don't want to tell them when they've fallen. They really just don't want to be a burden. And so it's us as a second family member to them. We can provide that to them with maybe even a little bit more patience and where they don't feel bad for asking us. But, around mental health, it's really been challenging actually for us to get people to participate in, say, the Pearls program or other mental health services that we have. You can't just have it and say, hey, here is a program, why don't you sign up? A lot of people don't want to reach out for help, or they don't think it's for them. But we do hear a lot of people talking about things like, oh, I'm up all night worrying. I am not able to sleep. I can't stop thinking about this, or they're just so bothered by things. And so those are the little signs, telltale signs that we would like to let them know that that might be a sign that you could benefit from our Pearls program or some of our other activities, and that it doesn't just look like depression. It doesn't just look like crying on the floor in the kitchen, you know, like there's lots of different levels to it. And so for us, it's going to be important to create a education campaign this year, and create also a launch of peer support programming, and then really just getting to know the people that come in and use our services, so that way we can help identify who might be a good fit for things. And I think that's the last slide there. Thank you.
Thank you, Danny, very much. I'm going to back up just because I just think that we should look at faces of real people while we have our next speaker talk. But thank you, Danny. Please stay on if you can. We're going to finish up with Stephen and then have some questions and some talk. But
You got it.
Stephen, thank you.
Man, Danny, you hit the nail right on the head. I mean, holy cow. What she kind of talked about really sums up the reason why I'm personally here today. I kind of call it, she said it a lot more eloquently. I call it self-induced isolation or loneliness with a lot of my clients, because culturally that's what we do. As we get older, we want to let our kids live their lives. We don't want to bother them. We don't want to do this and that. And next thing you know, they kind of get into this little hole where they're too embarrassed to really kind of tell you things. And they're like, I don't want to bother you. I don't want to do this. I don't want to do that. And I actually recently experienced that with my own parents. Here I am doing it for 80 to 100 other people. I'm looking at my mom and dad and they're like, oh, no, it's okay. Don't worry about it. And I was like, wait, and come to find out and spending more time with my parents. They're like, hey, I'm really glad you're coming around a little more often. Me and your dad been married 50 years. We ain't really got much to say no more. So we're just kind of like, wow, that's not untrue, So at Lac Hong, we do our services are extremely similar to everybody over here in one degree or another. What makes us different is we are we are direct to community. So we're right there in the middle off of Willcrest and Bel Air for those of you that are in this area. And when they come in, we give them a very paramilitary structure in their day. We give them value in their day. And how we accelerate that is we nutritionally dope them up with a lot of sugar, and good nutrients and all that fun stuff, right? So they come in, they have a great breakfast from like 8 to 9:30, and then at 10, 11, 12 o'clock, we always have things for them to do, whether they're going to be socially stimulated through bingo. I mean, Jesus Christ, I'm trying to look for the next bingo. If anybody has anything else that can captivate them and really get them going like bingo, please let me know. The Price is Right has been our second best, but still. But we get them going, we get their emotions stimulated, we get their minds going, we get them mad, we get them happy. And I feel like when you do that, they're naturally just mentally healthier. They're socializing with their friends. They tell their friends, dang it, I was one number away from bingo, so you try to drive them to do that stuff. We have exercise programs from Tai Chi, sit and be fit. Sometimes some of y'all know I'm a fireman in this area as well. So I have some of my guys come and do these sit and be fit classes with them, and they're a lot better looking than I am, rest assured. And that motivates them to come and participate. Well, most of the ladies, right? We have field trips for Father's Day. This is going to sound really bad, but I take the guys out to Hooters, and they like to enjoy the chicken wings out there, You see? So we make them laugh. We get them engaged. And that's what we kind of do at that level there with them. We have tech classes. We try to make sure that just because a lot of people say old dogs can't learn new tricks, right? And I bet you I'm going to prove you wrong. My clients now schedule their doctor's appointments on their Apple Calendar. They have social media. They upload their videos onto YouTube of what they do over here, which may be 30 minutes of nothing, but it's for their families to see overseas. So again, we try to combat this loneliness ultimately at the end of the day by giving them some sense of value in what we do. So in a nutshell, yeah, we all kind of do very similar things. I'm just more on the community level over here. If you guys stay in this local area, I encourage you to come visit our facility. We are just off of Willcrest, just north of Bel Air. A good landmark is Enterprise Car Rental. They have this huge sign, okay? Because other than that, I kind of try to stay tucked away. It's a very plain Jane building because we don't want people to know we're there, honestly, But yeah, that's about us right there. So let's get going.
That's amazing. Thank you, all three of you. Danny, thank you. I was just thinking, I have lived in very rural Oklahoma for the past 24 years. And to think about the kind of services that are available in large cities, you know, and even thinking that there's not enough services, right? I mean, we hear about that a lot too, is that there's not enough beds, there's not enough centers, or not enough places for our elders to go. But I get so excited thinking that, wow, this is amazing. My mother is 80 years old. And it's so funny. Everything I'm sitting here thinking a lot about my own shame and, you know, guilt about my own.
We should be.
Right, exactly. Thanks a lot, guys. My mom fell the other day. The only reason I knew that she fell was she lives in an assisted living center and they called me. But mom hasn't told me that she's fallen. I mean, fallen enough that she had to go to the emergency department and have a CT. She hasn't told any of, you know, of us, because exactly I think what you're saying is she doesn't want to bother. And the only reason she's in the assisted living place is because from COVID, she had mental health issues. She became suicidal because she was living by herself. Didn't speak to anybody. And in the Native American culture, very similar to every culture, but we don't talk about that either. And we sure as heck don't talk about it to our kids. So it's very interesting and kind of heartening to think about the programs that are available, and you know, and that old dogs can learn new tricks. You know, my mom was a quilter and she was a gardener and she did all these things when she was younger, and she wants to be able to still do that, but she says, well, I'm too old to do it. I don't have anything else to offer anybody. So now I'm going to tell her about the 102-year-old, you know, woman over here that got the key to the city. I just think that's really amazing. But I also think if we don't know about the services that are available in our communities, how do we direct our patients, direct our loved ones, direct our community members to them? I guess I have so many questions, but one question is, how do you fund all these things? Because it seems a little expensive. I mean, the cars and I'm just looking at the screen here from our friends in Sacramento, but how do you fund a whole center? How does Houston fund all the services for the aging? Because you had so many different services, transportation services, and all the food, and how is that funded?
You know, for us at Lac Hong, we are not quite a nonprofit yet. I think that's going to be a point that we're going to get to. We funded it privately up to this point. We do use a lot of we are completely Medicaid based. Rest assured, you have to be extremely financially disciplined to run our program, because if you come to our place, it's bright and shiny, it smells wonderfully, you know, because we do put a lot of emphasis on sanitation, how the place looks. Because for us, if the place doesn't look good, you don't feel good, right? But I think Paul, you could probably tell us a little more about this here in a sec. You know, going the nonprofit route and having those grant dollars available would be able to further accelerate us differently. So that is actually one of the struggles that I'm going through, is finding better funding, because we've realized, even as financially disciplined as we are hitting a lot of barriers. And I think if we were a nonprofit, we could expand that substantially.
And Stephen, correct me if I'm wrong, but I thought you said that yours is a family-run,
It is
family-based.
family owned and
Family-owned
operated.
and operated.
My father-in-law had this idea, you know, in the early 2000s. He is very, very about the people, I guess you could say, because, you know, like most of everyone over here, our families immigrated here in the late 70s. So he was like, I know that at some point, we're a real estate family. I'm still in commercial real estate, you see. And with that being said, he was like, you know what? Our parents are going to get older at some point. We all get older at some point. There's two things guaranteed in life: death and taxes, right? You know, so with that being said, he was like, hey, where are these people going to be? Because it is one of the good and bad things about our culture here is, you know, when you get older, you retire, you just stay at home.
Mm-hmm.
You don't do anything. And that's where I say it's a self-induced loneliness. You see what I mean? So we've been doing that. And yeah, we were family run and operated. Been great. But I think, you know, we have to learn to evolve with the times. And this is going to be that transitional, pivotal time that you'll see us kind of evolve.
Okay. So for us, our services are funded through the Older Americans Act. So the Older Americans Act of 1965 is what actually, through across the years, and actually right now, the Older Americans Act actually has been revised. It is in the process of being revised, and we're excited about it because it's going to actually come out this year in 2024. And hopefully give us some more flexibility in what we can do. But area agencies on aging, and we call them AAAs, are every single county across the United States, and is the islands, I forgot they're called, also has a AAA. Every county is covered by an area agency on aging. So if you're looking for those, it's just a matter of putting in your county and asking what area agency on aging covers your county. There are 28 area agencies on aging here in the state of Texas. My AAA, Harris County is the largest AAA in the state, and it's driven by population. So it's very important when they do the census that people do the census, because that's what brings us the funds to allow us to do these services. The Aging Disability Resource Center is through the states, and those are through state general revenue as well. But every single county across the United States and territories, that's the name I was looking for, they're also covered by our Aging Disability Resource Center, also through the Older Americans Act.
Excellent. Danny, how about you in California? I would imagine maybe similar, but can you tell us a little bit about how your services are funded?
Sure, very similar, yes. Originally, though, like I mentioned before, we were very much volunteer led, and so it was like a grassroots effort where people would just put things together and donate things, and so we're very lucky to still receive a lot of donations. But over the years, as we've grown, we have received also state funding, and our AAA in the area has awarded us several grants for several programs as sub-grantees. The California Department on Aging has also given us state funding for our programs. But, you know, a lot of the times it's the biggest struggle. So we're always looking for new grants or opportunities, especially ones that last longer than a year, to help support our programs. Also, the Self-Help for the Elderly provides programming for utility assistance. So it's really a variety of different funding sources, which can be challenging for our accounting departments. But it is always something that we're looking for, especially as the times change. I mean, we're seeing more mental health funding. Our senior escort program was funded by the Stop the Hate campaign through the state, but all of those things can change within a election cycle, right? So it's always going to be the challenge for us.
Thank you, Danny. I really do feel like you do learn something new every day. And I think my takeaway from today is that AAA is not just the place people you call to fix your car when you have a flat tire. Roadside service. Yep. So I'm just really excited that, you know, you can actually Google the AAA and find out what services are provided in your county. That's pretty amazing to kind of hear. Do you all have any questions or comments or anything that you are, about what you've heard so far with the services that are provided here in Houston, that are provided in Harris County, that are provided really for any of our elder adults, or things that you're doing in your communities that, maybe you'd like to share with us? This is a small group, so I love to hear what others are doing and to kind of, feed off one another. Anybody have any questions? Comments? Yes, ma'am.
I just wanted maybe Paula to elaborate.
Oh, yeah.
I wanted Paula to elaborate maybe a little on collaborations, because even though the funding comes from, the different sources, I think a lot of key to communities might be in the local collaborations, because once people see, wow, I have a residential business, repair something, maybe I can work with AAA. And so I'm assuming that that's all over the United States, that similarly. So can you speak on some of the local collaborations, and maybe that would spark some interest of people to say, hey, I would like to do this.
Mhm.
What?
It's gonna be bumper cars here in a minute.
Forgot to roll.
Matter of fact, I was thinking that the chairs, like, oh, these are not good for older adults. Because they might fall. But thank you, Connie, for that question. Yes, for the area agencies on aging, which we call AAAs, not to be confused with the insurance, I would say 95% of our services are contracted out. We are the administrative piece of the program. And so I'm going to give an example. Stephen and I was just talking. When we put out a RFP, a request for proposal, we try to, because Harris County is so large, we try to look for nonprofits or mostly nonprofits, or we'll look for those who are small businesses that can serve an area. We know that, and we can look across and see where we have a lack of services. And a lot of it, as she said, Christy, is outreach and people knowing about our services. And so we will put out the RFP and we will ask, when we do that, where can you serve? And that will help identify, okay, we need more services over in this area. Let's say, I think we've had over the last couple of years in the north side of trying to get dentists or trying to get, and I failed to mention this, adult day, because we do provide that as well as respite, in-home respite, in-home respite and out-of-home respite, which is adult day. Trying to find those providers, but we look for those. We do have something that we look for is that we want you to be in business for 5 years because we want to make sure, because our contracts, because the contract is with the city of Houston, is a cost for reimbursement. So you have to be able, you don't get money up front. So I'll be clear about that. You get paid after you do the services. So within 30 days. So we need to make sure that you're solvent and that you can provide, you have the necessary you meet the necessary requirements to be a provider with us. You have to meet the City of Houston requirements, but also requirements that we as an area agency on aging will set. So because we want to make sure that when we provide services, and we don't look at the lowest rate, we look at can you provide the service? Do you have the capacity? Can you meet the needs of our older adults? And we look at it that way. If I'm going to send someone into your home, I want to make sure they've been background checked. So it's not, we put a lot into that. We've had contractors that have been with us for years, especially let's say on nutrition, and we've had the same providers because no one has the capacity that we need. We run about 8,000 seniors that get a meal a day. So we do anywhere maybe about 10,000 meals a day. And so you have to have the capacity to be able to provide the service. And we have to have a kitchen, and we have not been able to find someone that could meet that capacity for us. So there's a lot that goes into it, but that's how we look for community partners. Baker Ripley, for those of you that live here in Houston, Baker Ripley is a big partner of ours. Interfaith Ministry is a big partner of ours. Chinese Community Center is a big partner. TSU, we have an ombudsman program that has to visit every single nursing home in Harris County, as well as all assisted living facilities. UT is the contractor for that. And then we have other contractors like for dental vision here in Incontinence Supplies. We have national providers as well. And so we have probably about 50 or 60 contracts that we have to manage. So it's a it's a big operation.
There's a lot of things turning, a lot of wheels turning.
There are a lot of things
Yes.
turning, yes.
Do you also do you help or support your neighboring counties as well, or kind of help the other counties?
We refer to each other. Because there are areas like, for example, in Fort Bend, we back up to Fort Bend County. So we connect all the time with the Houston Galveston, and it's very confusing. There's Harris County Area Agency on Aging, and then there's Houston Galveston Area Agency on Aging. They don't cover Harris, they don't cover Houston. So it gets to be confusing.
They should change their name then.
I know. So Houston Galveston covers all of the 12 counties that surround Harris County.
Okay.
So, but I will make introductions to them to folks who, like there's an adult day that reached out to me recently that can service that's in Pearland, that may be a good provider for them. And I will share resources like our residential repair. They'll say, hey, because they're council of governments. And so the whole contracting can be a little bit sticky. And so we not share resources, but I will give them name of our providers that we use. And we do partner together when it comes to nutrition, because we can get a better bang for our buck when we bring in more providers. So they do about 5,000 meals a day. And so when you bring that all in, you get a better rate. And so, sure.
So, you bring up a very good point about having, say, your local repairman that wants to do stuff, right? For us, after COVID, we've realized that a lot of folks are scared. And Rosie, we were talking about it, scared, a little intimidated about coming back to a social setting, or even a lot of my guys and gals, they were unable to because they stayed at home so long. Now their body's not really able to really go out and do stuff. So what we've done is, we also have our own private nonprofit that does a lot of stuff with the Houston Food Bank because we do agree with their mission about stopping hunger, right? So what I do is we tell people, we put out ads on social media, which nowadays we know social media flies like wildfire. We're like, hey, you know what? If you're older than 65, because we're targeting an audience, right? If you're older than 65 and you're unable to get food, okay, and you're hungry, give us a call. And what we'll do is we prepare packages and we'll give it to them. But when it gets to their front door, we'll also have a little flyer or some resources. Hey, if you're hungry or you want some really great home cooked food, because that's what we do. We don't carry nothing in. It's all home cooked stuff that we have that's made fresh every day. Why don't you come to our facility and check it out? We'll even schedule MetroLift for you to come pick you up and all that fun stuff. And that's how we've had them kind of come through to our doorsteps. So if your guy wants to reach out to maybe some of his local neighbor resources that are helping his community, it's like, hey, you know what? And if you need some handyman services or whatnot, let me just add my little thing in there and say, hey, you know what? 20% off to folks that are 65 and older if you need, a hand. But this is where I'm going to partner up with Paula because something she mentioned that I didn't think about is, hey, who are we sending to these people's homes? What if it is a person that's actually targeting seniors for a not so good reason, right? So maybe partnering with her that I'm looking at now, I was like, hey, you know what? I should partner with you and hopefully be able to utilize your resources to pre-qualify some of these people before we send them to our folks home. And then also add some of the additional resources that I didn't even have. So now we're really killing 10 birds with one stone. Well, maybe bad phrase, but you know what I mean.
We don't want to kill the birds.
Maybe better. Yep.
Is the Better Business Bureau.
Oh, yes.
Because we,
So, Danny, here it is.
yeah, we need to be sure that we are looking at the Better Business Bureau. I know there's senior Medicare patrol and all types of services to make sure that if we hire or are there bad review, I mean, just basic things we should be doing as caregivers for our older adult parents or grandparents. Of course, calling the AAA and saying, do you have someone specific? I'm not sure if the local United Way checks, has background checks on people, if there's a service. And the only other thing, I don't know if I heard anyone mention was veterans at all, older veterans.
Feels to my advantage now.
So actually, I didn't mention this program. The ADRC, Aging Disability Resource Center, they do have a focus on veterans and veteran services, but we also contract with the VA for the Veterans Directed Program, which allows veterans, just like for, older adults, to be able to stay in their home as long as possible. And so we contract with them. It's not one of those programs where you can just sign up, but this is one where the VA sends us a referral, and then we work with the older adult they can hire their own loved one or someone out of the community, and a background check has to be done. And then they're able to get the services that they need. The VA gives them a certain amount of funds based on their needs. And so that's another program, but we do work with we work with the Mayor's Office of Veteran Affairs. And so we actually in the one of my staff just told me yesterday during the freeze, there was a veteran that got stuck here in Houston that was on his way to California actually and ran out of money. And because of the services that are here, he was able to make a connection to help that veteran get back. He was like, I think 72 years old, to get back he made it safely and sent back to California. So we do a lot of partnerships. That's very important for us to partner with other organizations so that we can, that collaboration is key.
Hey, Danny, are you still out there?
I am, yes.
If I wanted to send my mom to California to come live at one of these awesome centers, how does one do that? How do you get referrals? How does one decide that they want to come live in the area and have access to the programs that ACC?
Right. Well, we do have several care coordinators and managers that can do options counseling with families. And because a lot of times, what's great about our outreach is that we're trying to let families know about us before you need it urgently, right? So a lot of times they'll visit our care center, which is the rehab and the skilled nursing facility, immediately after an accident happens or things like that. But prior to that, we have our social worker sit down with them and say, figure out what is right for them. But each care facility, though, does have residential managers who will meet and figure out what is the best fit for them. Like our memory care and assisted living facility has a ton of activities and amenities and different packages of levels of care that you would like to have versus our independent and assisted living facility that is a little bit different and doesn't have quite as many activities involved, but is much more in circulation with the people who are just in apartments too. And they're right across the street from our community center. So, and some of them have friends in one facility and not the other. So, lots of different options. And so people will sit down with the families and figure out what the right fit is for them.
Excellent. I was just kidding. I'm not sending my mom to California. I promise. Or anybody gets mad at me. But what if I wanted to send her to Houston? And how would she be able to interact in programs and activities at your center, Stephen?
So for us, we've been extremely blessed. We do very little marketing. It's all word of mouth. You know, we do a lot of word of mouth of referrals. And even though we are in the international district, but even though we're more Asian, Vietnamese focused, we have a lot of Latino people that come by. And through our food program, surprisingly, they'll come in, they're like, hey, you know what? I would love to attend a facility like this, but you know, can my friends kind of come too? And that's what we do. We kind of get them all in at one social group at a time. And they've loved it, you know. So for us, it's like we're very blessed. It is word of mouth. We've been here for a long time. That's where people kind of know about us a little bit. But I agree with Danny, I think is what she said too, where it's like, hey, you know what? We try to get the word out before they really kind of need us. So when we do have volunteers that come through, they're like, oh man, I didn't know about these services. So we do our best to educate our community whenever we get a chance to even speak about it, about what we do. So if they, not even just themselves, but their friends or friends, families, whatnot that need our services, they can kind of come to us at some point.
That's exciting. That's awesome. Yes, ma'am. Give that to you so Danny can hear you too. Oh, flip it on. Yep.
Yeah, I just have a question about the your customer or patients. How about their out-of-pocket pay? So for your service, for all of you.
Do you want to take that, Paula, and then Stephen, and then
Sure.
Danny?
And actually something Stephen said, so the Area Agency on Aging Services are at no cost. And the number I gave you up front, there's actually some brochures out there in multiple languages. We have one number, and that's the 832-393-4301 number. And you just request the service. And our services are not emergency. We are not an emergency. No AAA is an emergency type services. And I did just want to highlight that we have a very good partnership with Adult Protective Services as well. But they just call. There's no, now our services are also some things like for adult day, it's not a adult day, for the most part, you can stay in adult day for an extended period of time. For in-home services, those are usually maybe about 90 days, and our care coordinators will work with you to develop a plan so that you can either move over to state health services, or you come up with a plan for family to help take care of the loved one. But there is no cost for any of the Area Agency on Aging services.
And for us, we are 90% a state-based service. So we are completely covered by Medicaid. If you have Medicaid, we contract with United Healthcare, which is now WellPoint, and I'm sorry, Amerigroup, who's now WellPoint, and then also United Healthcare. 10% of our folks is private pay, but that's kind of a smaller group, and that's a very specialized group because those are those kids that realize Oh man, my parents really need these services because they're not doing anything during the day. They're staying home, they're watching TV when they want to watch TV, they're going to sleep when they want to go to sleep, they're eating when they want to eat. Then they're wondering why they can't sleep at 2 o'clock in the morning, right? For us, Medicaid, we are one of their favorite children, I guess you could say. And the reason being is I was like, hey, if they are eating right, they're socialized, they're happy, they're physically fit, guess what? They're not going back to the hospital. They're not constantly getting sick. I think a few years ago, we did a study with Medicaid and they said our facility by itself saved them about $3 million in just rehospitalizational stuff. And you know that, Doc, so it's very basic things, but it's for us, the bigger part is just recognizing these things and being able to do something about it and connecting them to these resources.
Danny, how about you at ACC as far as out-of-pocket expense for your residents, patients?
Right. Well, so similar to Paula, so because AAA does fund several of our programs, it is also no cost, but with a suggested contribution or suggested donation sometimes. And some of the others are low cost or no cost at all for the home and community-based programs. And then for living facilities, some of it is covered by insurance, just depending on what someone's situation is. Like if they have long-term care insurance, it could reimburse directly up to 100%, just depending on what they have. But then some of the other facilities are all private pay with additional services that could be added on top of it. Especially like independent living is basically senior apartments across the street from our senior living facility or our community center.
Thank you. Yes.
So I think you kind of answered because of the you don't require them to be U.S. citizens or
Could you repeat the question?
So the question is whether or not we require our participants to be citizens. That's not a question that we ask. That will only come into play if someone for like Medicare, if they need Medicare or assistance with filling out application, then that's a requirement there. But it's not a question that we ask when we do intake at all.
Stephen?
All those eligibility.
So there are certain questions that we have to ask. It's required of us from the state. And so we will ask, we have to ask funding, financial information, but it is, I forgot what's the word for it. You're telling us. We don't ask for statements or anything like that.
Just self-disclosure?
Yes, it's self-identified or self-disclosed information, but it's because we're required to ask those questions from the state. But there is no, it does not deter you from being able to get the services.
Thank you.
Yeah,
Stephen, same for you. Okay. Okay, well, I got the 1 minute sign in the back. So I just want to say thank you. Thank you to Paula, Stephen, Danny for subbing in and hearing about your awesome program on the coast. We appreciate you here in Houston. Thank you everybody for being here. If you guys have any questions, I think we'll be around for a little bit longer. Yeah, thank you so much. It was excellent, lots of resources, and I really do think that you learn something new every day. So thanks for having us. Thank you.
Thank you.
Danny.